everybody and welcome back. This is Dr. Mridula here. So what are the common side effects that you see after a Lasik surgery? So generally Lasik is an extremely safe procedure that you can do, but like any surgical procedure which can have side effects, even Lasik does have some side effects. But let me tell you, they're very minimal. In fact, most of them are very temporary and they usually, recover over a period of time. The most common side effect that you will notice is dryness in your eyes. Your eyes can get extremely dry after a Lasik surgery. You might feel like, something is there in your eyes, a foreign body sensation or a little gritty sensation. But make sure that you use your lubricating eye drops as advised to you by your doctor, ophthalmologist, and you would notice that over a period of time it generally improves. The dryness reduces and you would start feeling much better. The next thing is you will also start noticing some glares or some halos, especially during night time. So I would recommend individuals that try avoiding your night drives, especially in the initial first few weeks. Okay, and then slowly you can get back. So here the symptoms would be there only for a few weeks and gradually it starts improving and you would start feeling much better. But the initial few weeks majority of the individuals will have a certain amount of glare and halo, and this can be quite uncomfortable for you, especially when you have to drive at night if it's a long distance. So you might also notice a little fluctuation in your vision or sometimes a little blurry vision on and off. So this is quite normal during the healing process. So generally the vision will stabilize by around 1 to 3 months. But some of the other rare complications are, one is you can have either an overcorrection or an undercorrection. Now this can be corrected later on, after 6 months to 1 year with an enhancement surgery. Or sometimes you can also have an infection or an inflammation, which again, like I said, is a very rare complication. It can be corrected with antibiotic eye drops, or you could also have any corneal flap related complications, which again is quite rare, and with the latest technologies right now it is quite rare, but again that can be corrected. So like I said, the take home message here would be most of the complications that you would get in Lasik are generally very temporary. That is, they will improve over a period of time and they're very mild to moderate. Okay, and most important thing is make sure that you use the eye drops and medications as advised to you by an ophthalmologist. And before you do any task, at least in the initial few days or weeks, make sure you consult your ophthalmologist. Okay, but let me tell you, the initial few days to the initial 1 week is extremely crucial for your healing process. Okay, so think about it. Take care.